Hello. In this set of video lectures, we'll be discussing coding diseases and disorders of the eye. Okay, as discussed, we'll be covering coding diseases of the eye, and these codes range from H00 through H59. And again, this not only includes diseases of the eye itself, but the lacrimal system, orbit, conjunctiva, sclera, cornea, iris, lens, retina, glaucoma, vitreous body, and globe. Other conditions included are diseases of the optic nerve, visual pathways, ocular muscles, binocular movement, combination refraction, visual disturbances, blindness, intraoperative, and post-procedural complications. There are a lot of coding notes in the tabular. Some of these include external cause codes when applicable, and referencing excludes two conditions for all of these codes. And again, excludes two means typically isn't coded, but may be coded if the documentation supports the additional code. So please make sure that you catch those. And then guidelines for glaucoma. There are very specific guidelines for coding glaucoma. These include how to code bilateral cases, different types of state and stages, evolving stages during admission, indeterminate stages, and others. This is all based on the clinical documentation, and these are in the chapter specific guidelines. So these are called out in your textbook. Please make sure to pay special attention to those. Other codes include codes for eye infections, inflammation, lesions, deformities, and other visual impairments. These can be coded with other conditions like diabetes and injuries. And you may want to review figure 10.1 for the anatomy of the eye that's in your textbook. There are also specific codes for disorders of the eyelid, lacrimal system, and orbit, and these fall in code categories H00 through H05. The lacrimal system produces and drains tears from the eye itself. And again, we talk about disorders and diseases of the orbits. We're talking about those bony cavities within the skull that house the eyeball itself and the associated eye muscles, nerves, and blood vessels. Disorders of the conjunctiva include conjunctivitis, blepharoconjunctivitis, which can be either bacterial or viral. And these fall into code categories H10 through H11. And again, when we talk about conjunctivitis, we have acute conjunctivitis. We need to code first the code T51 through T65 code categories to identify the chemical and intent. And again, that way we capture whether it's an occupational injury or not. And diseases of the sclera, cornea, iris, ciliary body that fall into code categories H15 through H22 include various inflammatory and structural conditions. And since we have two eyes, we need to specify laterality in the coding. We can also have disorders of the lens. These include the different types of cataracts. We talk about laterality, bilateral conditions. The code for age-related cataracts fall into code category H25, and this can include any type of opacity of the lens itself. You'll see sometimes terminology like cortical cataract, subcapsular cataract, nuclear cataract, and so on. We can also have infantile and juvenile cataracts, and these fall into code category, category, excuse me, H26.0. And these are congenital cataracts that are present at birth but may not be identified until the child's older. You may see terms like lamellar, polar, total, or nuclear. And again, this could be part of a birth defect, such as congenital cataracts, congenital rubella, Down syndrome, and so on. When we think about diseases and disorders of the retina, a frequent one is retinal detachment that falls into code category H33. And basically, this is a separation of the retina from the underlying retinal pigment. And this can present as floaters, flashing lights, cobwebs in vision. And this could be described as either a single break, total detachment, or a horseshoe tear, excuse me. We can also have retinopathy of prematurity, and this develops usually in both eyes and can produce a lifelong vision impairment. And these are very specific codes that fall into code categories H30 through H36. Glaucoma, which falls into code categories H40 through H42, is a group of diseases damaging the optic nerve due to increased intraocular pressure. The codes identify the types such as open angle or angle closure. And this will be our last slide. Glaucoma suspect is a condition that's identified in a patient who has risk factors that may cause glaucoma in the future, but right now has no optic nerve damage. Open angle glaucoma has no visual symptoms, at least initially. And that's all I have for you. Come back and we'll continue our discussion on coding diseases and disorders of the eye. Thank you.